Today we're talking about breast implants, ladies, and not just about any kind. We're specifically talking about gummy bear implants. Joining us now to tell us a lot more about it, we have Dr. Bridges from Bridges to Beauty in Shreveport. Dr. Bridges will be answering all of your questions about gummy bear implants for the next half hour. We want to encourage you to ask any questions you might have about it, anything that you're thinking about. If you're online, just fill out the information screen and submit it, or you can give us a phone call. That number is 318-219-4569. We'll be taking your questions until 12:30. So first off, why are they called gummy bear implants?
Well, they're called gummy bear implants because they feel like a gummy bear, okay, and they're form stable. Just like a gummy bear, basically, if you set it someplace it doesn't melt, okay, this won't either.
Well, I hope not, right?
Yes, yeah, that's a good thing.
Okay.
But they're form stable in that they actually do come in the shape similar to a breast with, slight upper pole fullness and then the fullness more in what would be the lower pole. Okay. They differ from your other silicone gels, which are basically round, in nature things. But the regular silicone gel implants give you better upper pole fullness. Okay, these are more or less specific for certain people. Probably maybe 15% of the population I see.
Do they look a little bit more natural?
They look a little bit more natural, but if you like the push-up bra look, where of course where it's not falling out onto the floor and things, then basically the rounds do very, very well with that. Whereas the gummy bears have less prominence in that function.
When did the gummy bear implants come out?
Well, they actually came out in terms of just public use by any physician over the past couple of months.
So they're very new?
Yes. They've been on trial and study for at least 10 years.
What are your patients saying about it?
Well, there aren't many that I put them in, okay, just because they're very, very specific for particular people. In other words, if someone doesn't come with a shape to the table, because what you bring to the table is just what important what I bring to the table. All right? If they just bring a little bit of breast tissue or maybe just a nipple stuck on the chest wall, this would probably be better for them than a round. Because you would see more of the roundness of the upper pole in your regular silicone gel implants than you would with the gummy bears.
Is it still very popular for women to get implants these days?
Absolutely.
Yeah? Because I feel like we're so used to seeing them, it's not always so obvious anymore. I mean, back in the early 90s, you could spot one, or at least I could. I would say, oh, yep, she has them, or she doesn't, and you could tell.
Right. I think the techniques have gotten better.
Okay.
I mean, the shape of the implants have changed over time. Like say, the most common one are the rounds. I like to use high profiles and maybe medium profiles on occasion. What you're trying to satisfy is the fact that when women come in and they want larger breasts, but they want better projection, okay, they kind of forward push, and they like upper pole fullness, kind of like if they're wearing a push-up bra. This won't supply a great deal of that, okay, in most women.
Okay.
If you come and you have some upper pole fullness, then yes, that will make it look fuller, okay, but the rounds tend to meet the needs of the majority of people I see.
But those are for women that may be a little bit smaller.
Yes, or if they've had a mastectomy.
Oh.
Because they bring nothing to the table.
Oh.
Okay? This is a shape that would be appropriate for someone who had a mastectomy.
Okay. Well, talk to me about leakage, because I know a lot of women might be concerned about any of these implants potentially leaking.
Both of these implants, the gels and stuff, are called cohesive gels. It's just in how cohesive they are. This is very cohesive. In other words, it's fairly stiff. I mean, it's soft enough to feel like regular breast tissue, but people can feel their gummy bears more than they would a round implant. This is very soft. Okay.
Can I feel them again?
Yes.
Yeah. Let me see. Okay. I want to compare. Okay. Yeah. Okay. You definitely feel a big difference, actually.
Yeah. I think
it's a lot more firm.
Yes. The rounds, again, if you have a little bit of coverage on top of them, they feel like normal breast. Whereas your gummy bears, generally people bring less tissue to the table. They will feel the gummy bear more. It's not something that basically is intrusive to them or something they dislike. It's just, I always tell them they'll feel it. It's like with the salines, I tell everybody they'll feel their saline implants.
Is one heavier than the other?
No, they're about the same.
I was just trying to weigh them out in my hands to see if...
No, they're about the same. And this is a 335 cc implant, okay, and this is a 300 cc implants. So, this is about a shot glass more than basically that one. It's wider, okay, cc for cc, it's a wider implant. So, there's a lot of measurements that go into play when you put, an anatomic implant in than this one, because if some people bring, like, say, different shapes to the table, like their chest wall. Their chest wall, they can wear a 34, 32, and it looks wider than that. Okay, and so you really have to measure it out before you say, well, I'm gonna put this in, it's gonna give you C or D or something along that lines. So there's more measurements with this, and you have to have, you have to have absolutely accurate placement of the gummy bears or the form stable implants than you do with the saline, the silicone gels, the round silicone gels.
Okay, well, if you have a question about the gummy bear implants versus other implants, Dr. Bridges is more than happy to answer any of your questions. Give us a call at 219-4569. The lines are open right now until 12:30, so go ahead and give us a call, or you can also ask us a question online at ktbs.com.
You were mentioning the Rupture.
Yes.
Okay. Remember in the 70s and 80s and maybe early 90s, if you look back on the silicone gels and ask, what was the rupture rate? In retrospect, looking at the studies and then the follow-ups, and when we had that flood of people who wanted to get their silicone gels out because they had some fear associated with it.
Right.
Depending on the study you look at, anywhere from a 30 to 50% rupture rate in 10 years is what you found with the old silicone gels. Okay, with the new silicone gel, whether it's cohesive at 10 years is 1%. Okay, and I wonder how that happened, because remember, there's nothing in your body, okay, that works on these. In other words, these are silicone bonds. In other words, it's like a flexible glass. You don't have an enzyme in your body that can break a silicone bond.
Okay.
If these were a plastic shell, which is a carbon-carbon bond, most of the bonds that are broken in the body in terms of proteins, things like that, are carbon-carbon bonds. So if this was a plastic shell, I don't think it'd last a year.
Oh.
So rupture rates on these, probably for these silicone gels, is probably 2% in 10 years, maybe a little bit less. And these are, again, the longest day we've seen is 10 years, and it's 1%. So they're fairly stable. For a man-made product, I always tell people, you have to put it into perspective that these are man-made products. Kind of like your car. At some point, you're going, it isn't going to work very well. Again, the likelihood for this is very small. In 10 years, you only have 1%, leak rate or rupture rate. We don't know how long they'll last. That's a great. You're trading your car in 10 years or less.
Oh yeah. Also,
with the implants, there is a warranty. Okay, for the first 10 years, two of the companies that do it, which are Allergan and Mentor. These are Allergan. I prefer these implants. In first 10 years, if you have a rupture, okay, they put actually money towards the facility fee and surgeon's fee, and that covers the most of it, because the implants, and they're expensive. Okay. But even after, and they give you a free implant, okay, even after 10 years, you get a free implant. Okay, and these implants are not cheap. Okay, these implants probably cost, both these together are probably $3,000.
Wow.
$1,500.
Compared to the silicone ones? What are they?
Silicone gels are probably close to, they're probably about $1,000 a piece. So basically $2,000 versus $3,000. Again, I guess it's from the manufacturing, research, et cetera, and things. I think that's the biggest cost difference, because silicone itself is a relatively cheap substance.
We do have an online question for you. This one is from Susan. Is the healing time the same?
Yes, it's the same. Remember, everything I do is a calculated trauma. All surgeons be people for a living, including me. All right. As far as your body is concerned, it doesn't care much for it. She will have swelling, okay, and generally the swelling is not as bad with the gummy bears from the standpoint they're sloped, and when the muscle swells over, it isn't quite as obvious. Okay, when you swell with the silicone gels and stuff, you'll have a little bit more pole fullness. With the salines, it's even more than that. But I always tell people just to prepare them. Okay, number one, just like if you twist your ankle, you're gonna have some swelling, you're gonna have some soreness. Okay, and you're going to have plus minus with some bruising. All right, the swelling when it comes to breast augmentations is in the direction of up. So instead of round, I tell people they'll look like a couple of loaves of bread before they look like breast.
Oh.
It's going to do it.
Yeah.
I mean, the body's always going to do
Can
what
your
it's designed
body
to do.
outright reject them?
No.
No. It'll eventually get used to it and carry on.
Oh, absolutely. Yeah. It's the soreness that you're going to feel after any of the breast implants. That, you know, the silicone, the form stable, or the round silicone gels, or the saline implants. It's a muscular soreness. I put them underneath the muscle, because the more coverage you have on top of something that doesn't really look like a breast, the more it looks like a breast, the more natural looking it is. Okay, when you put it underneath the muscle, it's a muscular soreness. It's like you went to the gym, you did like 20 or 30 push-ups, wake up the next day and say, I'll never do that again. And then it heals like that.
Okay.
First day sore, second day sore, third day sore with stiffness. How about the fourth, fifth day is more of a stiffness than a soreness.
Is it sore enough that you have to take pain medication for it?
We give it.
Yeah.
I mean, probably most people take it, and then they'll switch over to some ibuprofen, because most of it's inflammation. Okay, I don't like ibuprofen before, and I don't like it within the first 24 hours afterwards, because it thins the blood.
Right, right. Well, speaking of exercise, if somebody is very active, maybe a runner perhaps, is there one that's better for that person, or will they both do okay?
They'll both do okay. They'll both do okay. Most runners I see are on that thinner side, so the form stables would probably do a little bit better from them in terms of giving them some shape. I mean, if they're real, avid runners, they really don't have a great deal of body fat, and so they usually don't have a lot of breast tissue to bring to the table.
What about scar tissue? I know that's a concern for some women too.
Well, there's two types of scar tissue. One is at the incision site. Okay, and generally it heals. I'm leaving behind this razor thin line. Okay, and everybody's body decides how much scar tissue to put there. I mean, surgeon doesn't decide, they don't decide, their body decides. Okay? And so generally I like to put it in inframemory fold, because it's out of sight, out of mind. It heals great there. It usually is about as thin as a mechanical pencil lead or less. You have some people like redheads that really bug me. 20% of those, they'll be going along, it looks great and things, then they'll start to get a little ropey. Lord knows why, but that's what you'll see. And we have some treatments for that, but that's the only ones that kind of raise my eyebrows when they come and want a breast implant.
Okay. Can it fold or ripple or take on a weird shape at all?
Well, as you can see, with this like this, okay, it's sitting in that pocket just like this and stuff, and you can see a little bit of folding. Less with these than you can with these. That's why most people that I see come with a B cup or something along lines, and so they have coverage. And you put it underneath the muscle, this is all covered up. Okay, the salines, they have a lot more rippling than these. But it's just the nature of them. These are a little bit on that wider side, because this is a 300, 335. Again, the shot glass more than this one over here, but the base, the base of this is wider than this. That's a real important feature, because you want, if you're going to use these, you want to match up the width, okay, on that side with the size of the implant you're going to use. Because like I say, a woman can come in, they're wearing a 32. I look at them and say, does it look like a 32 to me, or does it look like a 34, or does it look like a 30? 40%, 50% of women will have a flatter chest wall in this direction. Okay, so it looks wider. Okay, the breasts always have to match up to what the chest wall looks like. I put it this way: this is your frame, shoulder width of your chest. Okay, and this is the picture. Picture needs to match up to the frame. I have people come in and say, I want to go from B to a C. And they have this real wide chest wall. I said, you won't like it. It's all about proportion. All about proportion. So, I try to match up proportion, with the frame, okay, and height comes into that in some people, and the size of the picture. That will make them the happiest.
That's a good way of putting it. I like that.
Yeah,
it makes it easier to understand what you're talking about.
It works, because if you look at how our brains work, if we see anything, we look at basically symmetry, as far as like basically and proportion. And so basically, then it guesses at whatever the cup size and things are. It either says, I like this because it's symmetrical and it's proportional to the things around it, or it doesn't. That's how our brains work. And then, like I say, it guesses at other things.
Okay, we have a couple of online questions for you. Let's start with Barbara. If I have breast implants, but I'm unhappy with the results, could I change to the Gummy Bear implants?
You can, but you have to figure out what you're unhappy about. Most people in the, from the time we had to use the saline implants, we had 15 years where we were using saline implants. And if there was a complaint associated with them, it's basically their ability to feel them. I mean, water has the density of water. Okay, this has the density of Jell-O. So your tissues, your breast tissue stuff, is more like, you know, these two things than basically water. So when you go to the shower, they'll feel this little rippling out here. And so that was a little bit annoying to them. Now, so, you know, other complaints you had with this, with like the saline, was size. If they want to go bigger, yes, she can go bigger. If she wanted upper pole fullness, then basically I always use well, don't always, but the majority of the time I'll use a high profile implant because it gives you better projection and better upper pole fullness than the smaller ones will, or the medium, or I don't use low profile silicone gels because I think it's just like your upper pole that comes with your Form Stable. It's just not much.
Gotcha. Doris wants to know, is there a price difference?
Yes. The Gummy Bears are probably $1,000 more than basically your regular silicone gels.
What is it in total? What are you looking at? Because that's just purchasing these, and that's not the operation or the recovery or follow-up, checkups, and all of that kind of stuff. What kind of investment are you thinking about?
Well,
most people make?
For regular silicone gels, it's probably around $5,000, maybe a little bit more. Okay, for the Form Stable, it is probably $1,000 more than that. Okay, so that's kind of what you're looking at. Silicone, salines are less. Okay, again, there's advantages and disadvantages of each of these things, but I'm seeing more silicone gels than I'm seeing saline right now. Okay,
well, if somebody at home is thinking about breast implants, not sure which kind or whatever, just knows that they would like to explore that option. Sure. What's the next step for them?
Well, you have to have an evaluation. So, you know, call the office, get an appointment, and I can explain better the entire, benefits associated with either of them. Like I say, I believe, in terms of patient population, the Gummy Bears are probably only appropriate for 10, maybe 15% of people, maybe a little bit more. Okay, and that's what you'll see nationwide. They're not for everybody. They're certainly not for everybody. The gel is dispersed more. Okay, so the amount of volume that you can get from it is probably a little bit less. Okay, if they want that projection upper pole, again, there's not a big advantage to using those because they don't give as much.
Right. Well, maybe some people might like that because some of them can look. You still can tell some women have breast implants.
That's 5% of my population.
Yeah.
So 5% thinks now these on the market, that 5% thinks they can have that kind of, quote, natural slope. It's certainly not the majority of them.
Oh, well, that's very interesting to know. Are they limited in sizes? Can you get them all in the exact same sizes? Because I know they're different shapes.
Yes, you can get them in the same sizes. And depending upon, you notice that basically these two, okay, the height of these are different. Okay, this has a smaller height as far as it does. This has a longer height. That's why you do the measurements. If someone comes in with a longer thorax, then basically they're probably going to need the higher upper pole portion of it. Okay, because again, this would limit this a bit. You can still get the same projection as far as the lower pole, but if someone's shorter in stature, then this would probably be a better bet for them.
Is it possible for them to completely bust? I know we were talking about leaking a little bit.
Well, that's when you can cut it in half and nothing comes out.
It is very much like a gummy bear.
Yes.
Is there another name for it, or is that this technical name?
Form Stable implant.
Okay.
Yeah. And you notice this has a special coating to it. Or it's basically, it's called textured. The reason for that, and the reason you make it into a real tight pocket, is that you want your tissues to kind of grow into this feathery looking stuff. The reason being, remember, this is not symmetrical. Okay, and basically it's round on this side, round on this side. It has the same amount of fill on this side, this side. The problem you have with Form Stable or shaped implants was the fact that they're sitting on a different shaped surface. Some are flat, some are round, some of them fall off like the top of the house. And so if this is a flat bottom and it was smooth, okay, no, it didn't stick to any tissues. Okay, when you lay on your side, it would rotate this way.
Oh.
Okay, basically it's like this. You lay on your side and things, and basically it rolls this way because there's nothing holding it in place if this was smooth. These are smooths. Okay. So you really want this to stick to the tissues on the inside. And it has probably an 80% chance, maybe a little bit more, of sticking. Okay, I mean, there's nothing absolute when it comes to any of the operations. Okay, they designed these so that basically this will be wedged in place, stick there, and basically not do that turning.
Not move.
Yeah, because that's a little annoying.
If it does move on you and it gets stuck in a different position, does it look funny? Do you have to?
That's what I'm talking about.
Yeah, go in and get that.
It was more a long time ago. All we had with the saline implants, they came out with a saline implant that was shaped, similar to this.
Yeah.
Okay, and they were slick. They really weren't textured and things. And I stopped using those fairly early on because people would come in, they said my breasts look kind of funny and things. By the time I saw them, they looked perfectly fine because they didn't rotate it back. But when they wake up in the morning, it looks a little funny in the mirror.
Gotcha. Are there age requirements? Do you have to be of a certain age? Well,
the recommendations by the FDA is basically you have to be 22 or older to get a silicone gel. Okay, that's just a recommendation. You don't have to really follow that. Okay, I'm not supposed to say that thing, but essentially, they would like it, and there's not, in my opinion, a good reason for it. They say, well, it's developmental. They might grow from age 18 to 22. I don't think I've ever seen somebody do that. If you're an A at 18, you're probably going to be A at 22. So there's really not a good reason. And it isn't because of the material. Okay, I mean, the contact that you have is the silastic. It's not the gel. And even if the gel were to rupture, okay, it's benign. When your body doesn't mind it, it's not going to at that point try to reject it. Your body is already taking care of these implants. In other words, the day you wake up from an implant, your body says, where the heck these come from?
Right.
It's not part of the original factory installed equipment. Okay. And then it says, I don't mind it too much, but just in case, it builds a little fiber shell around. A little thin layer of scar tissue, about the thickness of a couple pieces of paper. I mean, it's supposed to. It does around joints, it does around pacemakers. It's supposed to do that. Okay? So, and that's to protect you. So if any of these were to rupture, per se, and again, this one, nothing would happen and things, but in this one here and things, it would, it would slowly probably leak out of the bag, but it's real viscous. I mean, it's like truly like a Jell-O. So it would have a ways to kind of before it kind of melded out. You don't absorb it.
Okay.
Okay. I mean, it's not going to go all over your body. Okay. Your body has contained it. I haven't with these implants and stuff. I've never seen silicone gel outside of the fiber cage that your body made for it.
Oh.
No.
Well, that's good to alleviate some potential worries some people might have, right?
Yeah, the worries that people had in the early 90s were, does it cause lupus? Does it cause, rheumatoid arthritis, scleroderma, fibromyalgia? All the studies show that basically, except for maybe a little bit of fibromyalgia, a little blip and things, there isn't a problem with this. Okay, basically the correlation was who gets breast implants? Well, young white women. Okay, who gets those diseases? Young white women. So it wasn't a comparison. Those women who didn't have implants, those women who
may have
had
been
implants,
cause without causality.
it was an association. In other words, there's no cause and effect.
Right.
It's an association.
Right.
It's like there's more cancers in areas that have more telephone poles. That doesn't mean telephone poles give you cancer.
Gotcha. What about any restrictions once you get them in? Can you hop in the shower the next day? I mean, what can you not do?
No, every physician has a little bit different things. I wait 2 days. Okay. In the seminars and stuff, some people just get them up the next day, take a shower and things, put the Steri-Strips back on, and they go about their business. So it's just, I guess it's a little bit of hocus pocus when it comes to that. But, most physicians are used to a routine worked out for them, and they stick to it.
Okay. How many times can you replace them? Because you said you'll want to do it, the lifespan is about 10 years, so you're going to need to replace them. Say you're in, your early 20s, if you want to get this done.
In 1%. The lifespan is 10 years.
Oh, so really you don't have
to
keep them?
No.
Okay.
Now the FDA wants you to get an MRI every 2 years. I don't think that's going to happen.
So how long do they stay in the average person?
In the days we were taking out silicone gels because people were afraid of them, I've taken some out that were 30 years old that looked perfectly fine.
Wow.
Okay, so basically we don't know. Okay, and like I say, they've changed the formulation of even these silicone gels and stuff. I mean, they're a type of cohesive, but they still have like smaller molecules in it that make it this soft. The problem you had with the original silicone gels is they had lots of silicone oil in them. Okay, and what that was is this bag at some point was made of silicone oil, and basically it makes it. If you put silicone oil next to something that was made of it and things, then it starts to dissolve. It's like you can take gasoline, you can turn it into styrofoam, but you certainly can't pour gasoline in styrofoam. It melts. Okay? This would take a long, long time for it to melt. I mean, at least the original ones did. Things like I say, I've seen some 30 years old, things that are perfectly fine, like they put them in. But I have seen some that did rupture. But in the 80s, you had 6 or 7 different manufacturers from all over the world. Their formulations were different. Some had more silicone oil, so their likelihood of rupturing was much, much higher.
Do they get hard over time?
They don't. It's just that little fibrous balloon that your body builds around it, that little cage and things. If it gets smaller, then it's going to squeeze this into a hard ball. Okay, it's called a capsule contracture. Okay, and I see people on occasion that come in and it's been, their fibrous tissue, again, their body kind of decides those things. Okay, where it got tight. Okay, you need another operation to kind of go in there and break that up. Okay, and then you massage very, very aggressively for at least 3 months and stuff, and it's probably not going to come back.
Oh, that's interesting. So there is something you can do about it.
Yes, yeah. In the old days and stuff, we used to kind of squeeze them to try to pop that shell. Okay, the problem is it didn't pop in a regular fashion. It's not like it exploded like this. It usually popped along that lines, and you can get some changes in breast that weren't very pretty.
Okay.
And it's not recommended either.
Once you get them implanted, how often do you need to come back for a checkup to make sure everything's okay with them?
Well, what I do is, I probably check people a little more often than others and things, but I'll follow them out to, depending upon the person, 3 months to longer. There's really not, I don't bring people back every year, things along lines, as if most plastic surgeons don't, because they're kind of rocking and rolling. I mean, there isn't much that's going to change over that period of time.
Okay.
Now, you do want to wear support. I mean, I do have some women come in, it isn't very frequent, where they say, I can't wait to have my implants so I don't have to wear a bra. Well, that's wrong thinking.
Really? I've always heard that too.
No, well,
no. Okay.
Breasts live off the edge of a cliff all their life. There's only one direction.
All right.
There's only one
Makes
direction
sense.
that's going to go. Okay, so, and this, adding some weight to it probably doesn't help that. So you just want to treat them normally. It's not a free ride. So you can wear sundresses and things like that, and you don't have to be chained to your bra. Just respect the fact that they live off the edge of a cliff. We don't live on the Starship Enterprise. We got that gravity issue. That's what's going to happen, and your body remodels over time. And so those are the things that you want to hone in on.
Do they fall normally? Speaking of gravity.
Yes, they will fall normally. Now, typically, like say, if you put most of the ones you can put these on don't have much breast tissue, so they're probably not going to fall. Okay, and these are fairly well stuck in place. I mean, if the fibrous tissue grows into it. So, sagging with these, they're probably going to sag like they did before, which again, most of the people I'll put them in don't have much to sag. All right. Now, with your silicone gel, other silicone gels, again, they're in there, they're off the edge of a cliff. I do like to put them underneath the muscle because it has more, I guess, holding power. Okay, and it just keeps them up there longer.
Okay.
I don't like for exercise, one of the things I don't like people to do after any of the implants is, if they're big exercisers, I don't like them to do pec work. I don't like them to do push-ups. I don't like them to do, the bench presses. I don't like them to do the pec flies with the Nautilus. The reason being is pretty practical. Like I say, the majority of the ones I put in are underneath the muscle, okay, because it looks better that way.
Right.
And you got to think that basically any of these things to be like a big old wad of toothpaste underneath that muscle.
Okay.
It's attached real strong here. It's attached strongly across like this. There's no attachments before or after a surgery laterally. Okay? And the natural shape of most ribs kind of go this way anyway.
Okay.
And so every time you contract that muscle, it's going to go in the direction where there's least resistance.
Okay.
That's laterally. Okay, so the pockets will expand that way. It's not uncommon if I'm doing an exchange, like someone has a saline implant, I'm going to a silicone gel, then I have to actually tighten that pocket up in that lateral aspect to kind of keep it up on the chest wall, because when they lay down, they got to go to the side. When they stand up, they look perfectly fine. It's just that pocket has expanded laterally because that muscle's chronic low-grade pressure over time tends to want to move in that direction.
All right, Dr. Bridges, we are running out of time. So if somebody is interested, can they give you a call? What should they do?
Yeah, give me a call. The number is 219-8555.
All right. Well, Dr. Bridges, thank you so much for being here with us.
Oh, my
we do
pleasure.
appreciate it.
All right, Whitney.
And thank you for joining us for Healthline 3. We'll see you next time. Bye-bye.